3 special functions. O2 suction. Press the O2 suction and the ventilator starts oxygen enrichment. The indicator light for O2 suction is illuminated and the remaining oxygen enrichment time is displayed in the prompt message field. During oxygen enrichment, the currently set oxygen concentration is displayed in the parameter setup field. Oxygen enrichment is active for maximum 2 minutes. This function is disabled when O2 supply type is low pressure. This function is useful for simple, quick, single button and safe, timed oxygenation to improve blood saturation. Suction maneuver. Press the O2 suction and the suction function is activated. System delivers high concentration oxygen to the patient. This is the first stage of suction. Clinician makes the judgment within the 120-second period of oxygen enrichment. If saturation looks good and the patient tubes are disconnected, the second stage of the suction procedure starts. The system stops ventilating the patient and you can apply manual suction to the patient. Reconnecting the patient tubes starts the third stage of suction procedure. The ventilator detects connection, starts ventilation and delivers high concentration oxygen to the patient. P0.1, PEEP-I and NIF functions are disabled if suction is activated. Nebulizer. Press the nebulizer and set the appropriate time. Select OK to start nebulization. The nebulization remaining time is displayed in the prompt message field. Nebulization is disabled in VAC, VSIMV and PRVC modes when patient type is pediatric. Also, nebulizer function is disabled when O2 supply type is low pressure. Nebulizer is disabled in standby. Manual breath. Select Tools, Functions and then Manual breath. The ventilator system delivers a breath to the patient based on the current ventilation mode. Manual breath is disabled during inspiratory phase, in CPAP, PSV mode and in standby. This function can be useful to synchronize 2 ventilators for independent lung ventilation.
Inspiration hold means to extend the patient's time of inspiratory phase manually and to prevent the patient from expiration for a certain period of time. Inspiration hold can measure the plateau pressure and static compliance. Typically, this function would be useful to take lung X-rays.
The expiration hold function can measure the intrinsic PEEP and trapped volume. Inspiration and expiration hold are active for a maximum of 30 seconds. P0.1. Select Tools, Diagnostics, P0.1, Start. The system starts P0.1 measurement and displays results when measurement is completed. Typically, weaning failure is predicted if P0.1 value is more than 4 cmH2O. Suction, PEEP-I and NIF are disabled during P0.1 measuring. After the measurement is completed, waveforms and spirometry data are frozen automatically. Negative inspiratory force. Select the Tools, Diagnostics, NIF. Press and hold the EXP hold and the system starts NIF measurement. You have more possibility for weaning when NIF value is less than -30 cmH2O. Intrinsic PEEP. Select the Tools, Diagnostics, PEEP-I. Start. The system starts PEEP-I measurement. Manual breath, inspiration hold and expiration hold are disabled during PEEP-I measurement. PEEP eye maneuver enables intrinsic PEEP measurement with minimal disruption to the ventilation. This function is typically used for COPD patients. They often have too short expiration time available, which is visible when the flow waveform does not go back to zero at the end of expiration, before the next breath starts too early. PV tool. Select the tool's PV tool. PV tool maneuver measures PV characteristic of the lung loop, with constant low flow inflation and deflation of the lung. From such loop, ventilator easily calculates upper inflection point, lower inflection point, and expiratory inflection point. Upper inflection point indicates highest desirable pressures. Some clinical evidence shows that PEEP setting of 2 cm H2O above lower inflection point reduces mortality rate of ARDS patients significantly. Select procedure and start, and the system starts PV tool measurement. After the measurement is completed, the system enters analysis screen. You can set the desired positions of cursor 1 and cursor 2. When you select cursor 1 or cursor 2, the selected cursor turns green. You can move the position of the cursor via the control knob to determine the characteristic points. The system also displays the volume value and pressure value in the inspiratory limb and expiratory limb corresponding to the cursor position and displays the compliance of these limbs. ATRC, Automatic Tube Resistance Compensation. Select the PAC mode and select ATRC. Set tube type, tube inner diameter, compensate level, and expiration compensation or not on the accessed screen. ATRC, Automatic Tube Resistance Compensation, calculates and compensates pressure when delivering gases via thin endotracheal or tracheal tube. Inspiration pressure will be increased on the ventilator side while calculating and displaying what pressure on the other side of the tube should be inside the patient. This will reduce work of breathing and have all the benefits of such reduction: shorter stay, better comfort, synchrony, and shortens weaning time. O2 therapy. Select the standby and O2 therapy to enter O2 therapy screen. Set flow and O2 concentration as required. O2 therapy is a mode where only O2% and the flow are set, and gas is delivered at normal pressure through oxygen mask rather than NIV mask. O2 concentration and flow and SpO2 pulse rate parameters are monitored only, with a handy timer and countdown on a screen as well. This feature enables simple spontaneous breathing trial, as there is no need to disconnect everything, and connect patient to external devices and monitors, as well as simple ventilation solution in recovery rooms to avoid nausea.